Hello, people. I follow Dr. Berg, who I respect him so much. He knows a lot. But as I've been following him, he recommended that if you have COPD, you should use vitamin D, 40,000 units a day. 40,000. Most doctors recommend 1,000, 2,000. Rarely they recommend 5,000. He said to use 40,000 a day. And I believe him because this guy know a lot. So let me play where he said it, and then we'll take it from there.
For COPD is steroids, okay, like prednisone
It's coming.
And other types of steroids that are like bronchosteroid inhalers, because steroids are anti-inflammatory. And vitamin D is the closest thing to that steroid cortisol that we're talking about. It acts like this anti-inflammatory, but without the side effects. It's a very powerful anti-inflammatory, but you have to take enough. So you want to take about 40,000 international units of vitamin D3 every single day.
You hear that?
Okay.
You hear that? I want to rewind that again so you can hear it. 40,000 every single
like
day.
It's anti-inflammatory, but without the side effects. It's a very powerful anti-inflammatory, but you have to take enough. So you want to take about 40,000 international units of vitamin D3 every single day.
Okay? You hear that?
That's going to reduce inflammation.
Okay, the title of his video is pretty much COPD, chronic obstructive pulmonary disease, COPD. He did this video 2 years ago, Dr. Berg. Okay, what happened? You turn the camera on me. Okay, what happened? It was a remote. Okay, what happened? I follow Dr. Berg. I love him so much because his knowledge seemed convincing, and I've been following him for a while. And I saw that millions of people follow him. At least he has at least 7 or 8 million subscribers. And his knowledge are convincing. But he has this effect of, convincing you that your doctor is not good. And to be honest, I have some experience with bad doctors. So I easily, was won over by him. So I've been using the recommendation he just made. Okay, I haven't used it exactly. Knowing that he didn't prescribe it to me, and that unit is kind of strange for somebody to take 40,000 a day, I'll be using half of it. So I'll be using about 20,000 units a day. Well, I started with 10,000 for like 2 weeks. It was good. No problem. Because I analyzed myself. I see, do I have any symptom of anything going wrong, blood pressure and all that? Everything was fine. So after 1 week, I went to 20,000 units that I was using for about just 1 month. Mind you, he said you can use it for some months, a few months, he said. I didn't play that, right? You can go watch the video for yourself. And I used it like a month. Guess what happened? My vitamin D went very high. And it's not normal for the vitamin, it's not regular for vitamin D to go very high, past the normal level. Mine was 154, 154. That was the number. When the normal range is between 30 and 80. It's between 30 and 80. That's the range that for when it's normal. Mine was almost double the maximum being 80 for it to be normal. Mine almost double it. 154 is near 160, which is the double of 80. You see that? So it's called vitamin D toxicity. It's dangerous. It can kill you. It can cause kidney failure. It can cause a calcium in your heart. It can kill you. It can kill you when you go that high. But thank God, my calcium is normal. By the way, I did the blood test twice. I did the first one on June 20th when it was 154. We did it again July 10th, which is almost 3 weeks later. And it's still the same. It didn't change. Well, it changed a little bit. It's like 147. It went from 157 to 147. It's still high. And the symptoms are horrible. The symptom of feeling of throwing up, the symptom of headache, the symptom of dizziness, the symptom of muscle pain all over, the symptom of stomach trouble, The symptom, what is? What is? Dizziness, weakness, nausea or vomiting. Some people vomit. I didn't vomit, but I felt like throwing up. Dizziness, especially, I hated that. And when I stand like 30 minutes to do whatever, I get dizzy. I have to sit down. So I be going through that. And I feel like it's my responsibility to warn people. Don't do it. Don't do it. If you want to do it, go see a doctor who has a proven record to say that it works. Because this could be dangerous. Imagine if I have taken 40,000 a day for like a month. Because like I say, I started with 10,000 for a while, and then I went to 20,000. I never take 40,000. But then my vitamin D got so high. Vitamin D toxicity, it can kill you. It's not even common. Doctors don't know how to treat it much because most people have low vitamin D. Rarely people have high vitamin D. So it's rare. They don't even know how to treat it. Or they will tell you there is no solution for it. There are some solutions, but now they have to analyze a lot of stuff to try. But they say you have to wear out. Of course, you have to stop taking the vitamin D, and then you have to wear out slowly or whatever. If they help you with some IV, some injection, you have to be drinking a lot of water. Imagine you are peeing every hour. Every hour you peeing. That's not comfortable. Every hour you peeing. So I just want to warn you, again, I don't mean to talk bad about Dr. Berg, but this thing he has said, I have experienced it, and it has hurt me, although I didn't use it fully the way he said to use it. So what if somebody uses it fully? So please be careful. That's the goal of this video. Thank you.